Welcome back. You are listening to the Maryam Mkwanda Show on Salam Media. So, in the midst of the coronavirus pandemic, it may be difficult to tell whether your sniffing, fatigue, or dry cough is a sign of COVID-19 disease or it's just an allergy. To tell us more is Professor Claudia Gray, who is a pediatrician and allergist at Kids Allergy Center. Good morning, Professor.
Good morning.
Thank you for joining me this morning. So let's start off with defining what allergies are.
Yeah, so that's a great question. An allergy is actually an unusual or abnormal immune response to something that actually should be harmless, like pollen grains, for example, or house dust mite, or the skin cells or saliva of cat and dogs. So most people should tolerate. It's almost seen as a parasite and something that they need to fight against. And in respiratory allergies, if we inhale such allergens, it can manifest in nose symptoms such as an itchy, sneezy, runny, or congested nose, or indeed, if you have an asthma attack, it can manifest in a wheeze or a cough or even shortness of breath if you breathe in a load of the allergen that you are allergic to.
Mm-hmm. Now, can symptoms of COVID-19 be similar to allergic disorders?
Yeah, so COVID-19, I sort of call it the great pretender because it can present in many, many different ways. So, as you all know,
Mm-hmm.
many patients are asymptomatic. And then you get the severe end of the spectrum where people are really sick and get this pneumonitis and have low oxygen and end up in hospital. So, those are really not going to be confused with allergies. But there's a middle
Mm-hmm.
group where people can have mild or moderate cold or flu-like symptoms with COVID-19, and there may be some overlapping features with allergies there. So allow me to tell you some of the overlapping features,
Mm-hmm.
and then perhaps
Please
some
do.
of the features to each disease. So COVID-19 is a response to the virus SARS-CoV-2. And all of us know if we have a cold or a flu, sometimes we get muscle aches and sore throats and fevers. But some of the symptoms can be similar to allergies. And those are the cold-like symptoms with a slightly runny or congested nose, bit of a headache, bit of a scratchy throat. So those could be common to both COVID-19 and allergies. But there's some symptoms or features that are unique to COVID-19, such as your real flu-like symptoms, fever, body aches, extreme fatigue. That would err more on the side of a viral illness, such as COVID-19. The loss of the sense of smell that has been described, I've seen that a lot. It can be quite sudden and quite severe. And that's not because your nose is just blocked. That's because the SARS-CoV-2 virus can actually affect the nerve endings in the nose, causing a dramatic loss of smell. Allergies, on the other hand, can cause a mild loss of smell, but not so severe, certainly a runny and congested nose, but itching is quite unique to allergies. So COVID isn't an itchy disease, but allergies
Mm-hmm.
are. So your nose would itch, your throat can itch, your ears can even itch if you breathe in what you are allergic to. So the fever and the body aches are more viral. The itching is more of a rhinitis or an allergy. However, as we mentioned, there can be a big overlap. And this is where it's so important to know whether you are an allergic person or not.
Mm-hmm. And now, for people who don't know if they have allergies or not, and it's spring now, and there's pollen everywhere, you won't be able to tell the difference whether you have COVID or you're just having an allergic reaction. So, how can you tell? How can we help them to tell the difference?
Yeah, so it's a very good point that we're heading into spring, and that's when our pollen levels generally start to rise. But remember, throughout the winter, we've had the winter allergies, so the indoor allergens, just house dust mite and pet dander and mold. So we've had to try and differentiate those as well. But spring in particular, so how can we tell whether we've got allergies? Well, has there been a pattern in previous years where this time of the year you suddenly get an itchy nose and you're congested and you're feeling not so good in your sinuses and your airways? If you have had a history in the past, it's a good year to test, because this is the mother of all winters and springs where we can confuse lots of conditions. So that itching pattern for pollen, especially if you're going outside or you've been in contact with freshly cut grass or trees that are pollinating, that severe itching, sneezing, rubbing, that should prompt you to go and have some allergy tests with someone who's qualified in diagnosing and treating allergies. And this is incredibly important, especially this year, for a number of reasons. So we've already said there's this overlap of symptoms. So goodness, you don't want to be that person who's confused as COVID-19 if you've just got a mere allergy. Because if you've got COVID, you're going to be isolated. You have to go through the trouble of being tested and contact tracing and possibly missing work for 2 weeks. So it's a big deal. Whereas if you've got allergies, they can be easily treated. So you don't want that confusion. Secondly, if you've got allergies that haven't yet been recognized and that are poorly controlled, you're probably feeling itchy and touching your eyes and touching your nose. And those are exactly the things we are told not to do in COVID-19, because we can acquire or spread the disease that way. If our allergies are untreated and undiagnosed, we can get COVID more easily because we're rubbing and touching. On the other hand, if our allergies are well controlled, then we can actually reduce our chances of getting and spreading COVID-19. So it's incredibly important. Allergies are easily diagnosed. If you go to the right person, you give a good history, they will listen to the pattern of your symptoms and they will set about testing you either with a skin prick test or a blood test, and one can easily find out if you're an allergic person or not and institute the correct treatment, which is generally very effective.
Right. So do people or children with asthma still have to wear a mask if they are allergic or if they have asthma? Because, I mean, it might be difficult for them, but do they still have to wear a mask?
Yeah, so obviously universal masking is probably one of our more effective prevention strategies for COVID-19. And remember that the vast majority of people with asthma, allergic rhinitis can be well controlled. So this is another reason for good control. Because yes, you're right, children with itchy noses who wear masks are always fiddling on their masks. I see that in my practice all the time. But the answer is yes, if possible, which is possible in the vast majority. And remember, we're not talking about our young kids. They don't need masks under the age of 5. It does probably more harm than good. But in the older kids, certainly, I actually do suggest that our asthmatics, they don't want to get COVID. It might be even more complicated if they get. So certainly universal masking should also apply to our people with mild to moderate underlying illnesses. In fact, I often say to my asthmatics who get symptoms in the cold or with exercise in the cold in the winter, it's actually quite a good idea to wear a mask when you're going out running or in the cold, because it reduces the cold air that you breathe in. So there can even be some advantages to mask wearing for asthmatics.
That's good news. And what about people of different who have different allergic disorders? Who is more at risk, or rather, what type of allergy would be more at risk?
Yeah, so we're talking about now risk factors for more severe COVID-19 symptoms. So as you and the listeners know, the vast majority, so 80% plus, are probably going to have a mild version of the disease. But we've heard so much about comorbidities. Be careful, shield if you've got a comorbidity, such as diabetes or obesity or hypertension or heart disease. Now, actually, Mild to moderate asthma has not been shown to be a major risk factor, or allergic rhinitis or eczema. So in fact, they are not. But of course, if you have a severe or brittle asthma, then you would shield, because any respiratory illness, be it a cold or flu or COVID, can send you into an asthma attack and be a risk of a more severe complication. But the vast majority of our allergy and asthma sufferers are not at increased risk of COVID-19 complications, especially if they're well controlled and taking their regular medications. And this is another important point. Asthma and rhinitis medications, even steroid nose sprays and steroid inhalers, are not a risk factor for COVID-19. In fact, we've seen with those with more severe COVID that steroids can actually be helpful. So patients must not be afraid of taking their regular medications. More than ever, it's incredibly important.
All right. Can allergies coexist with other illnesses such as COVID-19?
Of course, quite a great proportion of the general population has an allergy of sorts, be it eczema or allergic rhinitis or asthma. So they are, of course, just as anyone in the general population, especially if you're not taking the right precautions, they can get the double whammy of asthma and allergies and COVID-19. But important to remember, as I mentioned, asthma and allergy medications do not increase your risk. In fact, they probably reduce your risk of COVID-19. But as anyone in the population, of course, you can get it. But it's unlikely that you're going to get it more severely than anyone else, except if your condition is very severe and very brittle.
All right. And for more information, how can people contact you, Professor?
Okay, so in South Africa, we've got a great allergy foundation, AFSA, that has lots of information on allergies and asthma and even COVID-19. So that's allergyfoundation.coza. And I have a pediatric allergy practice, and that's kidsallergy.co.za. So the AFSA, the Allergy Foundation, can also be contacted, as well as the individual allergists such as myself.
All right. So thank you so much for your time, Professor, and have a wonderful day.
Thank you. That's a pleasure. Thanks for asking me to the show.
It's a pleasure. That was Professor Claudia Gray, who is a pediatrician and allergist at Kids Allergy Center. If you'd like to know more, you can visit Kids Allergy, especially if you have kids with allergies or if you are unsure about your kids having any allergies. And you can also contact AFSA, that's Allergy Foundation of South Africa. And if you have any comments, questions, queries, or suggestions, please send them to us on WhatsApp. The number is 061-766-0355. Alternatively, you can leave them in the comment section below, and also follow us on Instagram and Twitter. Thank you so much, Professor, and have a wonderful day. Bye-bye. Just stay with us. We will be right back.